Hi, Dr. Rodman here, and today we are going to talk about what to expect after your rhinoplasty. Now, it's important to know that rhinoplasty is very unglamorous before it's glamorous. When you first get home after your rhinoplasty, you're going to have a cast and some tapes over the bridge of your nose. You'll have some splints and some marshmallow textured packing inside your nose, and most likely some gauze taped under your nose. The gauze is there to just catch any drips of mucus or blood that may ooze down afterwards. The combination of the swelling inside the nose, the packing, and the little splints are gonna make it so it's hard for you to breathe through your nose afterwards. Some patients say that they can breathe a little bit, but just expect that your nose is gonna be pretty much blocked up for the first 6 days after surgery. That makes it difficult to smell. It may make it difficult to taste. It also makes it a little difficult to sleep because you have to breathe through your mouth while you have that packing in the nose. Now, it is normal for the nose to ooze and drip a little bit of blood, a little bit of mucus, or some kind of a mixture. That's what the drip pad is for. That's to catch any drips just so it doesn't get on your couch or get on your clothes. That's normal for up to 3 to 4 days after surgery. After the first week of dripping and oozing and being stuffy in the nose, for a rhinoplasty, the most important thing for patients to expect is that they will need to be patient. It takes a full year to see the ultimate result of a rhinoplasty. Generally, the nasal bridge or the nasal dorsum, that swelling will come out within the first 2 to 3 months, but the tip may stay swollen for up to a full year after surgery. In patients who are having revision rhinoplasty, it may be up to 2 years before they see the final result of the surgery. Now, that doesn't mean that it stays huge that whole year. A lot of the swelling comes out within the first 3 months, but you will continue to notice changes for the first 9 to 12 months. And now these are changes that I see, that the patient will see. It's generally not something that's obvious to everybody else, but you will see more refinement and more shape projection of the tip all the way up to 12 months. For patients who have to have their bones rebroken or their bones reshaped during rhinoplasty, they should not wear glasses or sunglasses for 6 weeks after surgery. Patients who have contacts should wear the contacts. Patients who are dependent on their glasses can do one of two things. They can either order a device. There's a couple devices that are sold on Amazon which help to hold the glasses up with a headband, or they can take a little bit of tape and tape the glasses to the forehead so that they're not resting on the bridge of the nose. It's also very important that the patient be actively monitoring and caring for the scar throughout the process. Patients are able to shower and wash their face after 48 hours. I recommend that they do wash that area with mild soap and water and just kind of gently rinse it with their fingers. Then take some hydrogen peroxide on a Q-tip and gently remove any crusts that have built up. It's very important that patients keep it moisturized with Vaseline or Aquaphor for a full 2 weeks after the procedure. Once there's no scabs or no crusts, I like patients to switch to scar gel. I recommend a scar gel with silicone and sunscreen in it. That will keep the wound moisturized and prevent any sunburn or sun damage from causing the scar to become red or hyperpigmented. A new post-op problem that we have encountered in 2020 is how to wear a mask after a rhinoplasty. Now, I want my patients to wear masks. I want them to be safe. So I do think it's important, but a couple tips that have helped my patients so far. I've generally found that the cloth masks tend to compress the tip a bit too much, and some of the stronger, sturdier masks tend to compress the dorsum too much. So what I'm recommending is that patients get the blue surgical masks that have the little wire over the nose. Pinch the wire so that it rests gently on the sides of the nose, but it's not digging in or putting too much pressure on the dorsum of the nose. I've also been giving patients their cast which was used during surgery. I've been giving that back to them so they can put that on and then wear the mask over that. That helps to distribute some of the pressure across the nose and prevents one focal point from having too much pressure on it. Day 6 after surgery, you'll come back to my office. At that point, I take the cast off, I take the splints out of your nose, and with a telescope, I'm able to vacuum out any blood and mucus and crust that have built up over the first few days. After that visit, patients generally feel much better. They're able to breathe through their nose, they're able to sleep that night, and generally people are able to return to work the next day.